you have painful urination, frequent urination, difficulty urinating, and you're wondering, what does that have to do with breathing? That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. One of the common things that show up in my practice as a result of pelvic floor dysfunction is issues with urination. Now, while that could be so many different things, one of which is pelvic floor dysfunction. The answer to all dysfunctions, not just pelvic floor dysfunction, it's any movement and postural issues. The part of the solution is breathing. So you have to understand the importance of breathing, and one thing that I see with a lot of videos related to pelvic floor issues talks about the breathing right here. I've done a whole video on the importance of engaging the lower portion of your torso in your breathing. We're going to make sure that we put that at the end of this video so you can refer to it. What ends up happening is you have to understand you've got a abdominal diaphragm and pelvic diaphragm parallel to each other. Imagine an elevator is going to the bottom floor, which is your pelvic diaphragm. So if an elevator is going down an elevator shaft and it hits the bottom floor, it's not going to hit it at one end or the other end. It's going to disperse its weight on the whole surface and pushes it in. That's what pelvic diaphragm does. So if this is your pelvis and your pelvic diaphragm is here, that pressure pushes that ideally equally, into that pelvis, and then it comes right back out, which is involved in breathing out. With improper postural positioning, the improper alignment and positioning of your whole body, but we'll concentrate for the sake of this video on the pelvis. When there is that pressure, instead of dispersing on the whole surface, is more on one side versus the other side of this surface. We're talking about anus versus bladder. We're talking about rectum versus bladder. So if there's too much pressure on the front, it compromises bladder function. When it's geared more towards the back, it compromises the intestinal function. Either way, and it can be fluctuating back and forth. So that really doesn't get focused on in most practices when it comes to addressing pelvic floor and pelvic floor dysfunction. I just need to bring that up to your attention because frankly, the solutions a lot of times are partial solutions, so you get partial answer to your questions. If you have any questions, please contact one of the methods of contact in the description box. Contact the office, and I'll be more than happy to take a look and see what's going on. Thanks for watching.